Do you feel body aches, lack of libido, or sleepless nights after 50? Before turning to more medications, here's what science has found. Movement may be the most powerful treatment for the mature body. In this video, you'll understand how simple exercises help reduce chronic pain, improve sex drive, and restore your sleep. All backed up by real studies and without contraindications. Watch until the end and find out how a small habit can completely change your health and disposition. Your body hasn't stopped working. It's just waiting for you to get moving again. Subscribe for more content on vitality, sexuality, and real health in old age. When we pass 50, a lot changes. The energy is no longer the same. The willingness to get out of bed, the breath to climb stairs, the quality of sleep, and even sexual desire seem different. And the answer most of us receive when seeking help is almost always the same. Medicine. Painkillers for pain, antidepressants for tiredness, stimulants for desire, and sedatives for sleeping. But is that all that works? What if there was another way, more natural, simpler, and more powerful than one imagines? Science has a clear answer. The human body, even with the passing of the years, remains an adaptable machine. And what most activates this machine is not pills, but movement. Regular physical exercise, even if light, is now considered one of the most effective treatments for chronic pain, low libido, sleep disorders, and even cognitive decline. A study published by the British Medical Journal analyzed more than 300 clinical trials with more than 200,000 participants and concluded, exercise is as effective as drugs in many treatments for high blood pressure, mild depression, chronic low back pain, and even mild memory loss associated with age. Let's start with the pains. As we age, our joints lose lubrication and muscles tend to stiffen. Back, knee, or shoulder pain becomes common. What do most do? Take painkillers. But the relief is temporary. And what do the studies show? That simple mobility, stretching, and strengthening exercises, even if done for only 20 minutes a day, reduce chronic pain more than most continuous-use medications. Because exercise not only relieves, it re-educates the body to function better. Now, what about libido? Many people associate a drop in sex drive with hormones, especially in menopause and andropause. And yes, there is a natural hormonal drop. But a Harvard Medical School study showed that adults over the age of 50 who engage in moderate aerobic physical activity 3 times a week reported a significant increase in sexual disposition, self-esteem, and frequency of erections or natural lubrication. Why? Because exercise activates blood circulation, reduces stress, improves the body's self-perception, and regulates neurotransmitters linked to pleasure. Another factor, sleep. After 50, the circadian cycle tends to become dysregulated. The body produces less melatonin and, as a result, deep sleep decreases. The consequence? Tiredness, irritation, anxiety. Many resort to medications, but few know that the body can produce melatonin naturally again with the help of regular physical activity. A study in Sleep Medicine Reviews revealed that individuals over the age of 60 who walked for at least 30 minutes daily had deeper sleep, fewer episodes of insomnia, and less need for sleep medication. And the most impressive thing, the results begin to appear in 3 to 4 weeks of regular practice. No contraindication, no side effects. The body, even mature, responds, and responds quickly. But perhaps the biggest impact of exercise is on the brain. In a study by the University of Illinois, it was proven that sedentary elderly people who started to practice regular walking had an increase in the density of the hippocampus, the region responsible for memory and learning. In other words, exercise rejuvenates the brain. It improves memory, mental clarity, reduces the risk of dementia, and even helps prevent depression. So, we return to the central question, exercise or medicine? The answer is not to eliminate drugs. In many cases, they are necessary and life-saving. But remember that exercise is not just a complement. It can often be the real treatment. What's more, it acts on the cause of the problem, while the medicine often acts only on the symptom. And we're not talking about the gym or intense workouts. We are talking about walking, climbing stairs, stretching, keeping the body active. Natural movements. frequent, made with attention and intention. At 50, 60, 70 years old, the body still responds. And often, all he needs is for us to invite him back to life. Now that we understand how exercise can positively impact pain, libido, sleep, and even memory, it's time to dig deeper. Because many people say, "But I already have pain, I'm already tired, I don't sleep well anymore. How am I going to start moving like that?" And the answer is simple. You don't start because you're good, you start exactly because you're bad. It's the movement that takes you out of stagnation. It doesn't matter how old you are. What matters is constancy. And more than that, the right kind of exercise for the stage of life you are in. Let's start with the 3 essential pillars for those over 50. 1. Mobility and stretching. 2. Functional strength. 3. Light cardiovascular exercise. These 3 elements combined can transform the body in a few weeks. It's not about aesthetics, but about function. Walking more firmly, getting out of bed with less pain, climbing stairs without losing your breath, sleeping better, thinking more clearly, and, yes, to feel pleasure again, with oneself and with others. 1. Mobility and stretching. When the body loses mobility, it loses safety. Muscles become shortened, joints stiffen. This increases the risk of falls, imbalances, and inflammation. But the good news is that simple movements, such as raising your arms above your head, rotating your shoulders, leaning your torso gently to the sides, rotating your ankles, making slow rotations with your neck, all lubricate your joints, activate circulation, and awaken your nervous system. Doing this every day for just 5 minutes already completely changes the perception of pain throughout the day. What's more, it reduces the risk of falls by up to 30%, according to the National Council on Aging. 2. Functional strength. This is perhaps the most underrated of all. Many people associate strength with lifting weights in the gym. But no. Functional strength is being able to lift a shopping bag, hold a grandchild in your lap, get up from the armchair without support. And all this can be trained with simple exercises. Sitting and getting up from a chair, leaning against the wall and pushing gently with your arms, standing on one leg for a few seconds, slightly bending your knees with your hands extended in front of you. These movements strengthen the core muscles, quadriceps, glutes, lower back, and abdomen. It is these muscle groups that keep you standing, active, with an upright posture and without lower back pain. A study by the American Geriatric Society showed that people over the age of 60 who included functional movements in their routine for only 3 days a week were able to reduce low back pain by up to 50% and improved libido by increasing blood flow and body confidence. 3. Light cardiovascular exercise. Here's the point that most affects sleep and sex drive. The heart is the engine. If he is more active, everything circulates better, including hormones. Hiking, light dancing, stationary bike, water aerobics. All of this stimulates the cardiovascular system without impacting the joints. What's more, light exercise done up to 4 hours before bed improves the release of melatonin, the sleep hormone. And during the day, it increases the release of dopamine and endorphins, the hormones of pleasure and disposition. In other words, moving brings more desire to live. And when the body feels this desire, it opens itself again to touch, to presence, to desire, including sexual desire, not by medicine, but by the body's natural response. Now imagine, you have more energy, sleep better, wake up without pain. He begins to feel good about his own body. That well-being changes everything. The way you talk, how you move, how you look in the mirror. And that's when libido, joy, and pleasure appear again, without being forced, without needing to be rescued. You don't have to be an athlete, nor running, nor do gym series. You just need to move with intention, every day. And science confirms it. It is possible to improve sexual function, sleep quality, and physical autonomy, even starting at the age of 65. The question that remains is no longer, does it work? The question now is, are you willing to give your body what it's been asking for years? What if I told you that what separates you from a more active, lighter, happier life might be just a small daily decision? Not a big change, not a complex plan, not a heavy routine. Just the commitment to move a little every day, respecting your rhythm but gently challenging your limits. It's curious how the body responds. Even after years of stopping, even after surgeries, pain, frustrations, or diagnoses, the body wants to live. It is like a plant. When it receives light, water, and space, it grows, and the movement is that light. There are people who have spent decades with back pain, and after 3 weeks of light walking and stretching, they report that it feels like they took a weight off their body. There are men who, after completely losing their sexual desire, have returned to feel pleasure and connection with their partners after starting to exercise. There are women who have gone to sleep soundly for the first time in years after starting to stretch every day in the morning. And this is not a miracle. It's biology. Physical exercise regulates the production of endorphins, serotonin, dopamine, testosterone, estrogen. All this without the need for a pharmacy. The body is the pharmacy, and movement is the key. Now let's talk about motivation, because you may be wondering, but I can't keep a routine. I've tried it before. I always stop. And this is a common feeling, but it is born of a mistake, wanting to change everything at once. The proposal here is different. It's kindness with consistency. Start with 5 minutes. Yes, 5 minutes a day. It can be by stretching the arms, taking a deep breath, taking a walk around the block. On the second day, do the same. In the third, maybe walk a little further. In the bedroom, stretch when you wake up. In the fifth, add a strength exercise with your own body weight. In the sixth, listen to a song as you move. On the seventh, smile to yourself, because you're doing it. He is living. It's coming back. And do you know what comes after that? The body responds. You sleep better, wake up lighter. He feels less pain. He has more appetite, more will. And one day, without realizing it, you stop thinking, I need to exercise, and start saying, I can't sit still anymore. This is the turning point, the moment when the body regains control of its own life. And along with it comes deep sleep, the true energy, the renewed libido, the pleasure of living, of touching, of being touched. To look in the mirror and say, I'm still here. At 50, at 60, at 70. Time is not the enemy, inertia is. And the movement? Movement is their greatest weapon to achieve what medicines often promise, but fail to deliver. A life with more autonomy, pleasure, and meaning. Choose the move. Choose you. Subscribe for more content on vitality, sexuality, and real health in old age.